So I wanted to welcome all of you to our residency Real Talk. This is something that we do every month. It's meant to provide you with accurate and up-to-date information on what is going on with the residency application and selection process. It's something that allows us to communicate vital information to you, and that's an important part of our program. Before we get into today's topics, I want to say that it's an honor and a privilege for us to have you in our program. I know that I have had the pleasure of talking to most of you, and if there are some of you that I haven't yet had a chance to reach out to, know that I will be doing that here in the near future. And for me, what really gives me a lot of joy is the opportunity to get to know you. One of the things that our team will tell you is that when we start to get to know you, we get so excited about the things that you've been doing and the things that you want to do that I'm often heard telling our team that I feel so good about the future of our profession because I know that you guys are going to do great in it. And so we're really honored to be able to support you along the way. I know that you're doing rotations with us, but our program is so much more than rotations. We want to support your professional development. We know how hard you're working to become great doctors, and we want to support you in that process through the acquisition of your clinical skills and also mentoring. We want to help you become informed residency candidates, and we have tremendous amount of experience in this area. So this webinar is another way for us to support you in this process. And I always want you to know that you are not alone in this process. You have a way to contact me, you have my phone number, so don't ever hesitate to reach out if you have questions. So today, in this webinar, Residency Real Talk, today we're going to be talking about the personal statement. As I've been talking to many of you over the last few weeks, I know that's a concern that's weighing heavily in your mind. And we have a chance today to really dig deep into personal statements. So I'm going to share my screen and let you see some slides that I've created. While we're going through these slides, I'm going to share some key information. And I'm also going to invite Dr. Ryan Downey, whom you've just all met, to also share his perspectives as well. Both of us have a tremendous amount of experience in personal statement development. So let me go ahead and share my screen. Okay, so what we're going to do first before we get into personal statement, we're going to talk a little bit about where we are right now in the residency application process to give us all a bit of a reminder of what we need to be doing just so that we can put ourselves in the position to succeed. So here we are, July 2022, and let's talk about what we need to be working on. So the first thing we need to be working on is our research on the programs to which we are considering sending our applications to. Now, depending upon your specialty, that number, of course, varies. But if you're going after internal medicine, we're talking about over 500 programs. If we're talking about some other specialties, maybe not as many, but again, in the 100, 200 range is not unusual. And so that's a big job, researching programs, but it's an important job. And it's something that I really recommend that you all do a little bit every day. Because researching these programs has so many benefits for us. First of all, as you all know, it's going to cut down on the expense of applying. These application costs can really climb quite high, but using a targeted approach to where you send your applications can help you save that money. But it goes well beyond expense. So researching programs also allows you to prepare a better residency application. In a little bit, we're going to be talking about fit with residency programs and how important that is. So when you're researching programs, you get to see what that program's mission is, what they're really looking for, and get to kind of see how your background aligns with what they're trying to do. And so that's a very, very important part of your research. And of course, this year we have many, many specialties participating in the supplemental application. Remember, that is going to open on August 1st. And in that section of your application, you have the opportunity to participate in program signaling. This is where you can tell a certain number of programs that you have deep interest in training there. And that's a very important part of our application this year because we know from the few specialties that participated in this last year that program signaling was very important to them and let a lot of students get interviews at these places. So when you're researching programs, you're looking to see what their criteria are and how that meshes with your profile so that you can target programs and signal programs where you're going to have a better chance of getting interviews. So a lot of reasons to research programs. Now, some of you may be wondering, how in the world, Dr. Desai, am I going to get through 500 plus programs over the next few months? Well, it's a big job, but one of the things that I always tell people is just carve out a little time every day, put it in your schedule, say to yourself, okay, from 8 to 8:30 for this half an hour, I'm going to research, read programs. And another technique that really helps you stay on track with this is also using the power of your friends and your colleagues. If you all are going after the same thing, you can divvy up the programs and that can help you reach your goals faster. And finally, you know that we are here to support you in every way. And we also have on our MD2B Connect website a list of IMG friendly programs and different specialties by state. So besides researching programs, what else do we need to be doing? We need to be working on our ARAS application, especially the description fields of our experiences, whether they're work experiences, research experiences, volunteer experiences, what have you. So the hardest part of the ARAS application are those descriptions. You have 1,020 characters, including spaces, and every bit of that space matters. And so it takes time to create those powerful descriptions. But the other reason you want to keep working on this now is that helps you get ready for the supplemental application. And so you want to be having one eye on that supplemental application because that supplemental application closes before you have to turn in your ARAS application. Remember, that's in mid-September. Now, what else do you need to do? You need to ask for letters of recommendation. A lot of you are currently doing rotations or will be doing rotations, but some of you have completed rotations. And if you haven't asked for letters, this is the time to ask for them. And of course, we know that our attendings and our preceptors, they need some time to do their work. So asking sooner rather than later ensures that your letters become available in a timely fashion. We also, when we ask for letters, we need to think about how we can help our letter writers write the best possible letter for ourselves. And there is quite a bit that you can do. So most letter writers will ask for your CV, but remember, there's additional material that you can provide that helps them craft a stronger letter. And if you go to the letters of recommendation chapter in our book, The Successful Match, now most of you have this book. For a few of you, you may not have it yet, but it's en route to you. And so you want to take a look at that letters of recommendation chapter and think about how you can help your attending write that best possible letter. We talked about the ARAS supplemental application and how that's going to be opening August 1st, but you can go to the ARAS website and learn all about the supplemental and what it entails. And that's something that's good to do even now here in July. Now, there are documents, many documents that you're trying to put together, some of which are under your control, some of which are not under your control. Of course, those are the documents where your school may be fully involved in preparing. And so those documents can take time because of the processes that every school has. So if there are things that you need your school to do, this is the time to really get after them, get those things going, follow up with them, and make sure that things are moving in the right direction. And finally, I talk to all of you about networking. This is very, very important. I recommend that to every applicant. Doesn't matter if you are a USMD, a USDO, or an IMG. In this day and age, networking is important. It's an essential part of your strategy. So please remember to continue to do that. Now, let's get into the big part of this, which is the residency personal statement. And we are going to talk about what you need to know, what to do, and what to avoid. But first, we're going to talk about just how important the personal statement is. Now, you're going to hear a lot of opinions. You've probably seen those opinions or heard about them from your friends, your colleagues, discussion forums, and quite often people hear the type of advice that, hey, the personal statement, it's something you need to do, but it's not as important as a lot of other things. And I want to present to you some of the data that will put into perspective just how important the personal statement is. And what I tell every applicant is every component of the application is important. And I view this personal statement as an integral part of our residency application. And we know from tremendous data on research in the field that personal statements are used by programs to make decisions about whom to interview, and they are also used by programs in the process of ranking applicants. So let's put some numbers behind what I'm saying. So let's talk about getting interviews, because right now we are all in this process of trying to do the things that get us interviews. So how important is the personal statement for getting us interviews? So we can turn to the NRMP documents, especially the 2021 NRMP Program Director Survey. And as a reminder, that's available at the NRMP website. And this is a survey where they looked at over 1,000 program directors representing many different specialties, and they asked them, what are the factors that are important to you in making interview decisions? And one of the factors that they probed with these program directors is the importance of the personal statement in this process. And what we learned is that about 84% of program directors are using the statement in making interview decisions. Now, another piece of data that is present in that document is just how important each factor is on a scale of 1 to 5. So 1 is not very important, and 5 is very important. And the mean importance rating of the personal statement for making interview decisions is 3.9. Now, to give you a reference of how that is relative to some of the other criteria that we're all very familiar with, if you think about USMLE scores, for example, step 1 and step 2 have a mean importance rating of 4.1 and 4.2. So you can see that it's not that far off from step scores. Now, the current thinking is that personal statements are going to take on more importance. And the reason for that is we are trying to shift our residency selection process to a more holistic review. The leaders of our medical education are been proponents of that, have been kind of moving that along, and you're seeing evidence of that of late in the terms of the step 1, for example, moving from a numerical to a pass fail score. So we're in this transition phase where there's a lot of work being done to encourage programs to shift to holistic review, and that may make the statement take on more importance. How about the statement and how it is used for ranking? Is it used for ranking? We did say that it is indeed used, but how important is it in the ranking process? So in the same NRMP Program Director Survey, the NRMP also asked directors about factors that are used in ranking applicants. And when they asked, do you use the personal statement? Many programs said yes. About 65% or so said that they use it in making ranking decisions. And the mean importance rating for that was 3.8. So it's not just in inviting people to interview, it's also important in the ranking process. Now let's dig deeper into just how statements are used in the selection process. So there's a number of things that programs are trying to glean from these personal statements. So first, they're trying to form an overall impression of you as an applicant. So they have a lot of information about you from your ARAS application, your transcripts, your USMLE scores, and so on. But the personal statement gives them information that is not accessible to them from other parts of your application. It gives them an idea of what's important to you, what makes you unique, but gives a real broad and overall impression of you as a person and what you have to offer as a professional. Now, I mentioned that it can give them information that's not available in other areas of the application, and that's important to programs, right? They're really trying to understand who you are, what makes you tick, and what you have to offer. And I want to share with you this quote from a program director who said, I want to know if there are any items that I couldn't discern from the rest of the ARAS application, such as a disadvantaged background or a big life event that impacted them in a way. And so those types of things may not be quite apparent to them through your other application materials. And so one of the things that we do with MD2B Connect is outside of our rotation program, we have what we call admission services, and one of which is our personal statement service. So we spend a lot of time with applicants really probing who they are as a person. And what we typically do, and Ryan will also sort of comment on this, is we ask people a lot of questions about themselves because we feel like everyone is certainly unique. Everyone has their story, and we want to really understand that story because when we understand that story, quite often we see things that are remarkable. Now, to the applicant, it may not always feel as remarkable because you're close to it, but there hasn't been an applicant or student that we haven't met that doesn't have something interesting to share, something that a program director would find appealing. So, Ryan, would you agree with that?
Yes, absolutely. I think it merits underscoring this point. Everyone has got something to offer. Everyone has got something that makes you stand out. And it's not that your goal is to do something extraordinary that's going to set off a major negative reaction, but you have a very limited time to make a positive impression. And we put a lot of effort into helping our clients uh, highlight those parts of their background that will leave a mark, leave a memory for those program directors to help them get to know that person and say, wow, I really want to hear more about that. Let's get that person in for an interview.
Right. And you will see some of those questions that we ask people in the successful match book. So if you go to the successful match book and you open up the personal statement chapter, that's a very extensive chapter that dives deep into what programs are looking for in personal statements in terms of content. And we spend a lot of time there talking about how to brainstorm the questions that you should ask yourself to help yourself find that content that Ryan and I are talking about because you all have it. It may not be immediately apparent, but I promise you there is rich material in your background, and that's what you want to bring to the surface so that you can make yourself really stand out with this personal statement. Now, how else are personal statements used in the residency selection process? Certainly, communication is very, very important to residency programs. So you will be doing so much every day in a program as a trainee, but at the center of all that is how you communicate, right? How do you communicate with your patients? How do you communicate with your teammates? There's oral communication and there's written communication, and you'll be doing a lot of writing, right? A lot of EMR work, progress notes, admission notes. And so programs look at the personal statement to give them some gauge of your communication skills. And I've spoken to a lot of program directors representing many different fields, and they look at the quality of the writing and they feel that bad writing could be a sign of the type of work that you might do as a trainee. It might mean that you didn't take it seriously, and so when you're a trainee, you might have a poor work ethic, or perhaps you had a lack of perhaps they glean from it that you might be someone who has a lack of effort. And so personal statements are very important to showcase your communication skills. And so, as one program director said, I get a sense of the fluidity of their thought and their ability to communicate. Now, how else do programs look at these statements? They're looking at fit. So, we talked a little bit earlier about fit and how important that is to programs. And every program has a mission, has goals, and they are looking for people who fit in with that mission, fit in with the goals. And so what they're trying to ascertain from your application is how do your goals fit with the program's mission or their vision? And they can tell some of that, or they're hoping to tell some of that from your personal statement. They're looking to see if you have a commitment that aligns with what that program is trying to accomplish. So to give you a few examples, I interacted with a program director, at a conference, and his particular program is a program that is involved in rural care. And every year he receives a tremendous number of applications, but many of those applications don't express a fit with what the mission of the program is in terms of providing high quality care to rural populations. The same can be said about programs that have a primary care mission. I was talking to one of the attendings who is a preceptor in our program, and he's affiliated with a particular residency program. And the mission of that residency program is to develop primary care physicians. And so in their program, if they receive a statement that expresses an interest in subspecializing, that doesn't align with their goals. And that program's director, uh, feels very strongly about not interviewing candidates who express subspecialty interests. Same goes for other programs that might have, a bent towards producing clinician educators, and the list goes on. There's a lot of different things programs are looking for, but it's important that your program or your personal statement aligns with that. How else are personal statements used in the selection process? They're involved in screening and selecting applicants for interviews. We learned that from the NRMP data, but how are they used? Well, they are often used in the decision-making process in the initial review, or they may be used following an initial review based on other criteria. So a larger number of applications may be whittled down to a smaller number through different criteria, and then the personal statement may play a bigger role than in deciding interview invitations from that smaller group. One program director said, sometimes if they are borderline, I'm looking for reasons to invite them. And he was referring to his use of the personal statement and how if he's on the fence about inviting someone for an interview, if that personal statement is done very well, that could be the reason that he needs to invite that particular student. How else are personal statements used in the selection process? So once you get an interview, the personal statement continues to play a role, especially as you get closer to your interview day. Now, your interviewers are going to be reading your application in advance of your interview. So some of them will read it the night before, some of them will read it just before they interview you, but many of these interviewers will focus on the personal statement. And one program director said that I do use the personal statement as a means to help me in terms of the questions that I want to ask during the interview. So this can be a stepping point for how your interview starts. There may be questions that the program director asks that are directly related to the content that you include. So what that means for you is that you want to, again, make sure that you're sending statements to programs that show that fit, and make sure that you're ready to talk about every aspect that is featured in your personal statement. And that is an important part of your interview prep. We'll be talking more about interview prep in later webinars, especially as we get into September and October. But keep in mind that personal statements are used as a way to prepare interviewers for their interview with you. Personal statements are also used in ranking. Now, this is something that surprises a lot of people. People think, oh, okay, maybe the statements are used for interview invitations, but then maybe they aren't, so important in ranking. But as we showed in an earlier slide, 65% of programs are using it for ranking, and they use it in different ways. And here are the thoughts of another program director who said it's one of the components for which people can move up or down. So if two applicants were completely equal and one had a really great statement, then we would rank that person higher. Now let's get into what personal statements should include. So Ryan and I spend a lot of time talking about compelling content. Earlier we said that all of you have some compelling things in your background. It, again, may not be immediately obvious, but it's there. And that's what you're trying to mine when you reflect upon your experiences, when you give all that careful thought to where you've been and what you've been doing. You're looking to find that compelling content that will allow you to stand out from the other people that are vying for the same position. Now, how do you do that? One of the key ways to do it is to construct your personal statement with a strong hook. So when we say a strong hook, that's something that you lead with your personal statement and it grabs the attention of the reader. This is very, very important. And I'll draw a comparison of this to interviews. So we know from a robust set of literature and research, and not just in residency interviews, but from interviews in all disciplines, that the first impression that you make in an interview can correlate very, very well with your overall impression, how you're rated in an interview. And that first impression is so important. And similarly, with personal statements, how you start your statement is your first impression that you're making. So if you grab their attention and you kind of excite them and you kind of make them want to read the rest of your statement because you have such an interesting or strong hook, that can have a halo effect on your entire statement. So one of the things that Ryan and I talk a lot about is finding that hook. Okay, so one program director said, it often gives me a unique hook about the person that sticks with me. And I sometimes catch myself thinking of that candidate and even referring to them as the one who wrote about blank in their personal statement. And so, one thing that Ryan and I talk about is how can we have this applicant be remembered for something memorable, right? Something prominent. If they can be remembered for one thing, then that's really made quite an impression, right, on the interviewer or the program director. So I'm going to stop for a moment and just bring Ryan into that. Ryan, we talk about hooks a lot, don't we?
We sure do. Yeah, it's so important. And there is an art to the hook. It's not just about the jump scare. It's not about turning someone off. You have to strike the right tone. Um, it has to be compelling. You have to come up with some vignette or some quote, maybe a famous philosopher's quote, something that will make the reader pause for a moment and say, wow, I want to know more about this thing, this topic, this patient example, this situation that the writer has created. And as Dr. Desai said, we've got hundreds of candidates, hundreds of names. And what we really want more than anything is for your names to be at the top of the list of names that are recognized as they're going through your application. One way that we can do that is to make that vivid connection between some really strong hook and your name and the rest of your application.
So to give you an example of what we're referring to by hook, I remember a few years ago, I had a student who really wanted to go into internal medicine and really was going after a university program, some of the more competitive university programs. And as we probed his background, one very interesting thing that struck me was some of his research. And what was very interesting about his research is it had to do with honeybees. And the research was centered on honey. And in order to do his research, he had to uh, become a beekeeper essentially. And initially, he had a fear of bees, and he slowly, with experience and practice, he got more comfortable around bees, and he became a beekeeper, and he used, the work, the honey in his research, and so that hook was related to this, fear of honeybees, and then how he sort of overcame them, and it was very, very interesting how he led off his personal statement. And at every interview that he went, he would often get people who would comment as, "You're the guy who's the beekeeper." So that was his fill in the blank, the one who wrote about beekeeping in his personal statement. And if you can be memorable for that reason, you've really made an impression on them. So look for your hook. You all have it, I promise you. And for more examples of hooks, refer to the personal statement chapter in the Successful Match book. There are some sample personal statements there with some very interesting hooks. Finally, here in this slide, what else should your personal statement include? Again, information that shows how your interests match those of the program or convey fit. Now, I know some of you are probably wondering, well, how can I possibly show fit with all these different programs if I'm writing a single personal statement? Well, you're not limited to a single personal statement. You can write multiple personal statements. You can send individual statements to individual programs. And if you want to communicate that fit, that's one way to do that. And sometimes programs are very explicit on their website that they want to see that fit. They'll come right out and say, in your personal statement, we want to see X, Y, and Z. And they want to see that because they're trying to assess whether you do, in fact, have fit with them. And if should you see that on a program website, then it's very, very important to try to create a statement that has a bit of content that's going to show them that you have that fit.
Make
Now,
one more
what?
comment about the
Yeah,
hook, Dr. Desai,
go
before we
ahead.
move on.
Sure.
I just want to emphasize the importance of how relevant the hook is to you as a person. We don't want to give the wrong idea that your goal is to just say something in the first couple sentences that will stick in someone's mind, but that you have nothing further to say about that quote or that vignette, that real life example. So you have to find that moment or that thing to talk about inside yourself that's meaningful to you, and in doing so, then you've basically introduced yourself to the reader, starting with your first sentence, and then they'll want to continue to read more. So that's just a afterthought about the hook that I wanted to emphasize.
No, absolutely. Thank you, Ryan, for sharing that. And moving on to what else should be included in your personal statement. Of course, we talked about the importance of communication skills and that we want our personal statements to be well written. We want them to be interesting, as we've been talking about. We want to highlight those unique characteristics and experiences you have. Those are things that help you stand out from the competition. And very important is to consider including information about red flags. So you need to think about whether or not you have a red flag. So a red flag is defined as something that you believe might be concerning to a program. So it could be an attempt on a USMLE exam. It could be a low score on an exam. It could be a large gap in your background. It could be a problem that you had with a clerkship grade. It can be any one of a number of things, but as you're looking at your background and you're asking yourself, you know, boy, I think I have something that the program might be concerned about, the personal statement is a great place to write about it. We often see applicants who shy away from addressing a red flag. They sometimes get the advice that, oh, you don't want to go there, you can discuss it in interview. But remember, the whole purpose of the personal statement is, along with the rest of your application, is to help you get interviews. So if a program has a concern about you, this is your opportunity to reassure the programs that that concern should not weigh heavily in their mind. So what we do when we have applicants who have an area of concern is we address it in the personal statement. And program directors strongly feel, that applicants should do this as well. Here's one program director said, there's something in an application that could sink an applicant. Add some material in your statement because this is their one chance to provide a narrative. Ryan, do you want to talk a little bit about red flags?
Absolutely. It's something that we see with our personal statement work quite a bit. You're trying to walk the line between admitting that something bad happened, you had a rough day, or you had a rough series of days, or maybe you changed your lifestyle for a little while, you relocated to another country, and you didn't do anything for a couple years. You were setting up a family or getting settled. Those gaps, those periods of time show up in your ERAS application, and the people reviewing your application go through these a lot. They have a large quantity. They get used to and automatic with detecting gaps in your chronology, and if you don't explain it, that jumps out, and they notice it, and they wonder what you were doing during that time. And so it's just in your best interest to confront it head on, to say, yeah, this happened. I didn't do as well as I wanted, and here's what I did to fix it. That you have the insight, you addressed it, you came up with some new strategy, and now, in effect, what you're saying is, you don't have to worry about this anymore, program director or admissions committees. I've gotten this behind me and I'm ready to succeed in your program.
Great advice, Ryan. So remember, if you do have some red flags, this is the place to address them. Now, let's talk about some mistakes to avoid. So, careless errors. We see a lot of careless errors. And I've read thousands of personal statements in my 25 years sitting on several different residency selection committees for internal medicine. I have read thousands of statements, seen a lot of careless errors. And sitting in a selection committee meeting, we this stuff will come up, and it makes programs wonder if your careless errors in a statement means that you will also be similarly careless as you go about your work as a resident. And so we do see a lot of misspellings, we see a lot of bad grammar. You can see what this program director said: misspellings, bad grammar, and poor attention to writing detail are a big sign that they maybe don't have the attention to detail to be a resident. What else do you want to avoid? Cliche statements, statements that are essentially overused. I want to help people. There's a lot of these types of statements that people encounter when they're looking over these statements. This another thing to avoid is quite obvious, but actually surprisingly is quite common, which is sending the wrong statement to a program. And a lot of applicants are applying to multiple specialties. And it's actually common for programs to get a statement was meant to be sent to another program in a different specialty. So if you're applying to multiple specialties, you want to be super careful not to send the wrong statement. If you're applying to a single specialty but developing multiple personal statements, perhaps you're going to be creating many different statements trying to show fit with different programs, it can be very easy to assign the wrong statement to a program. And obviously, that is going to be very hard to recover from. So please be careful as you're assigning your statements. Other mistakes to avoid: remember, you're trying to tell in your personal statement things about you that they can't glean from other aspects of your application. You really want to give them a sense of who you are. As we've been talking also about fit, you don't want to fall into the mistake of not showing interest in their specific program, if that's something that they have expressed as being important to them in their website. Sometimes we see statements where people write about something negative, could be about someone that they've worked with, and quite often they're doing that to show that they've learned something from that experience, that they worked with somebody, perhaps it wasn't a positive experience, but that they took something away from it. Sort of that "I don't want to be like this person" personal statement, and that can be a hard statement to be successful with, because again, you're going into some negatives, and if it's not done well, it can prove to be problematic. We also uh, do see statements that show arrogance or overconfidence in what one has accomplished. And that is something that you want to guard against. Now, the flip side of that is we see a lot of statements that don't do justice to what you've done. Okay, so we have a lot of applicants, IMGs all over the world that have done remarkable things. And we often see that those things may not be featured at all in a statement, or the way in which they are written about is done in a very understated or underwhelming manner. And that hurts the personal statement. So I want to stop for a minute and kind of talk to you, Ryan, about striking a balance, right? That's what we're trying to do, is not be way over here on one side or way over here on the other side.
That's right. And it absolutely can be a challenge to strike that balance. One thing that I have noticed is if you ask someone that you trust to read your personal statement and give you honest feedback, they will help you with your word choice. A lot of times we do notice it with people whose native language is not English. Sometimes the tone or the intention of certain words is not as familiar because you've been studying medicine and you're outstanding physicians. But asking someone who maybe is a English speaker to check, make sure that you're again walking that line, that fine line between being proud of what you've done and recognizing that there is something relevant and impressive versus being arrogant about it or bragging. And the same goes for the other side of the coin. It's sometimes valued to put yourself forward in a more modest way, but this is your opportunity with your personal statement to impress people, to make them want to get to know you better. And so we do strongly recommend that you have some folks look it over and make sure that you are calling out the high points appropriately and not undervaluing yourself.
No, that is great advice. And remember that what programs are looking for. They're looking for people who are going to be contributors. Now, all of you have contributed in significant ways to this point. And so you have evidence in the past that shows that you will be contributors in the future. So it's important to get that across, that make them feel that you're someone who is going to be motivated to make a mark when you become one of their trainees. And so you do have to, um, highlight some things, again, without crossing the line, but at the same time, not doing it in such a way that they don't get the full feeling of the significance of what you've done. So it is a bit of a juggling act, as Ryan said, but it's very, very important um, to achieve. Now, if you know me, I'm all about, evidence. As an internal medicine physician, we work really hard, me and my colleagues, to practice medicine in an evidence-based manner. And a lot of what we do here at MD2B Connect is based on evidence. So in our successful match book, a lot of the recommendations are evidence-based recommendations from an exhaustive review of the literature. And where there's no evidence, we will often turn to my colleagues in the field, program directors, associate program directors, for their impressions. But the personal statement is something that has not been studied in great depth. We're starting to study it in more detail. We're starting to develop some specialty specific research that's being done in personal statements, but we're in its infancy. And that's why it's so subjective, right? You get a lot of opinions about what should or shouldn't be in the personal statement. So to give you some sense of disagreements, okay, in what should be in the personal statement, I have a few slides here, which might some of you might find surprising. But again, this goes to the inherent subjectivity associated with this aspect of the application. So with respect to future plans, right? You may hear the advice that you want to include your career interests and your future plans in the personal statement. That sounds pretty straightforward, but believe it or not all program directors agree on that. So you have program director number one who says, I look to see if people have, at least at that point in their career, an idea about their career trajectory and any long-term career goals. And you can contrast this with program director two, who says, I don't think that personal statements have to say necessarily what someone's career trajectory is. Many people don't know. I don't think there's anything specific that has to be there. Another aspect of personal statement where people might disagree is the patient story. So program director one says, I always enjoy a patient story just because they're going to be doing a medical career. So I want to make sure that they're connected to patients. Program director two says something a little bit different and says, I think over-reliance on a patient story to tell a message that may not be very unique. So this program director is saying that, essentially you can tell a patient story, but is it really something that's very revealing? What does it reveal about you? Is it unique? And so, there's some differences, right, in thoughts between future plans, whether to include patient stories, and finally, even about your interest in internal medicine, right? The common advice is you should be writing a bit about why you're interested in internal medicine. So let's take a look at program director number one, who says something that references why you're choosing this specialty, because there's nowhere else really in the application to do that. Program director two says, I often just skip over those short paragraphs or the short statements of why I'm interested in internal medicine, or how I fell in love with internal medicine, I find these less helpful because you're applying to internal medicine. And of course, you want to do internal medicine. So again, for something that seems as straightforward as we should write about why internal medicine, you're going to have some people who might not be that interested in it. And that's part of the challenge of constructing your personal statement. And so what I would say to all of you is this type of data does make things, a little more confusing, right? Maybe a little bit unsettling, but it gives you a sense that there's a lot of different opinions on the personal statements. And so all of you have people you lean on, right? You have friends, you have family, you have uh, colleagues, you have seniors who are in residency, you have attendings. When you're thinking about who to get advice from, you have to be really, really careful. You really want to target people that have a lot of knowledge in personal statement development or reading personal statements, because the more people that you consult with about your personal statement, the more divergent opinions you're going to have. You're going to have lots of different opinions. And so we see a lot of people who show their personal statement to 10 or 15 people, and they get 10 or 15 different opinions. But really, what you need to do, and what we have found to be most useful, is to whittle down that number to about 3 or 4. Okay. 3 or 4 people, ideally, who know a lot about personal statements. That's your gold standard, right? Someone like a program director or someone who sits on a selection committee. Those are the types of people that you want to go after. Now, you don't always have access to those people, and other people are also useful. Like, you may have a friend who's a strong writer, and certainly that person could be part of your 3 or 4 people that you want to lean on. But I wanted to give you this advice because it causes a lot of stress when people get a lot of different opinions, and people get sort of paralyzed on which way to go. And so I wanted to let Ryan sort of jump in here and just also comment on that, because it's something that we commonly see.
That's right. We see a lot of deer in the headlights kind of experience when people ask too many people, even people that they trust. Maybe they've got 10 trusted advisors, but if you ask 10 advisors, you're going to get 11 opinions, and so it's just very important for yourself to trust in the process and recognize that you can't possibly make everyone happy. You have to listen to yourself, but also take into account the advice from others, and limit the gauge of the fire hose that is giving you feedback, because it becomes very uncomfortable for us sometimes to see folks who are getting feedback from other people in their lives, and they're just torn up internally. They're just having such a hard time deciding what to include in this statement, because you can only include so much in the amount of space that you have. So this is a very important and valuable piece of advice. Limit the number of people that you ask advice of.
Okay, so thank you, Ryan, for that. Now, for more information about personal statements, I've been telling you about the Successful Matchbook. Again, we have an extensive chapter on statements with evidence to guide your decisions on content. We have a lot of quotes from program directors. We have a lot of sample statements there. We have blog posts on the statement at thesuccessfulmatch.com. So don't forget to go to thesuccessfulmatch.com and check out those blog posts. And again, we have podcast episodes from our podcast, Success in Medicine, on the statement. One in particular that I think you'll find very interesting is on writing program-specific personal statements. Should you do it? How should you do it? What are some tips? So check out that podcast episode. You can access our podcast at thesuccessfulmatch.com or md2bconnect.com. So at this point, we do have another segment left, but we're going to take a break to answer some questions. And after we answer some questions, we'll do our last segment and then return to a few more questions after that segment. So Alyssa, do you want to jump in?
We do have quite a few questions, so I will start off in chronological order as we receive them. So our of an description of a rotation for an IMG should roughly look like?
I'm sorry, Alyssa, I couldn't hear the first part of that.
I'm sorry. So the question is, could you please give an example of how an ERAS description of a rotation for an IMG should roughly look like?
Yes, so that's a great question. So the first thing you have to realize is what programs are looking for. So what they're looking for is evidence from your clinical experiences that you are doing things that will allow you to be clinically capable and do the daily work of a resident from day one of residency. So if you think about what you're going to do as a resident on day one, you're going to take some histories, you're going to examine some patients, you're going to present cases, you're going to write some notes. So definitely those things that you're doing in clinical rotations need to be captured properly in the ERAS description field. Beyond that, you want to add additional material that shows that you are being exposed to some of the other things that you will be expected to manage with respect to patient care, with respect to your working relationships with other physicians, with non-physician support staff. So those are the types of things you want to get in there. You also want to write about the patients and what you've gleaned from your patients in terms of, what have your patients told you? Maybe in a particular rotation, you dealt with a population that had high degrees of non-compliance, and maybe you worked with your preceptor to really focus on how to support those patients, how to improve their compliance. So you might write a little bit about that. So it's really about thinking about what are some of the other things that you've taken away from a rotation that you're going to have to be dealing with on a regular basis in whatever specialty that you've chosen, and to try to weave those elements in with the bread and butter stuff that you're going to be expected to do every day. Because when they see that extra stuff, they're going to feel like you've been exposed to the key things that they need to help you master.
Thank you so much for the question, Dr. Desai. So next question we have is, what are your thoughts about program-specific personal statements?
So in this day and age, where there's been an explosion of applications, every program every year is getting more applications than ever before, it's really important to show fit. There's a lot of different ways to show fit. Program signaling, which we talked about earlier, is one way to do that. And that's a new way to do it. An older way to do it is writing program specific personal statements. Now, that is something that's been around for a long time. Most applicants don't do very much of it because it is laborious. There's a lot of effort and time required to do it. But if you have the ability to do that, you can communicate that fit. And to understand how important fit is, if you go to the NRMP data, to the Program Director Survey, one of the criteria is perceived fit with the program. And if you look at all specialties, it's somewhere in that 70 to 75% range of programs that look for that when they're making interview decisions. So program-specific personal statements is one way to do that. And that podcast episode that I mentioned, Success in Medicine, there's a nice episode there on, how to do it.
All right, thank you for that answer, Dr. Desai. On to the next question we have is, should I submit a letter of recommendation written a year before the application deadline?
So certainly you can. I would say to you, if it was written a year before the deadline, when did your clinical experience actually take place? So it could have been written a year before the deadline, but did the clinical experience actually take place a year before the deadline, or was it 2 or 3 years before that? So, the more recent the experience, the you know the stronger the way that that letter is going to be viewed. But letters that are written about a year in the past are not downgraded that much from letters that are just a couple months ago. Now, if we're talking about 2 or 3 years in the past, now that's a bit of a different situation because you're not the same person today, right? that you were 2 or 3 years ago. And they're really trying to get some sense of where you are today, because that's, going to give them an idea of your readiness to be successful as a resident. But I would not say that a letter written a year ago, if it reflects clinical activity right about the time of when the letter was written, I would not say that that is going to be detrimental to your application or will hurt you.
Okay, thank you for that. Our next question: is it important to have examples in personal?
I'm sorry, Alyssa, could you repeat that? I think on my end you were cutting out.
Yeah, no worries. My apologies. Important to have examples, personal statement. For example, clinical case.
So I only heard part of that, but I'm assuming that the question is it important to include examples in your personal statement like a clinical case? Is that correct?
Yes.
Okay. So it is just fine to do a clinical case. When you do a clinical case, or when you choose to feature a clinical case in your personal statement, it needs to be something that tells the reader a lot about you. We like to feature clinical cases when it shows that the applicant has gone above and beyond. So that's an example of a clinical case that we would be more excited about, because in describing that case and your involvement, we would be able to create a certain impression in the mind of the program director or the selection committee member that would make them feel, oh, if Smita did this in a rotation, that's exactly what I would want her to do as my resident. That we want them to feel that if we're going to feature a clinical case. So sometimes clinical cases are featured, but they don't really tell us much about the student or the applicant, right? And that's where problems can occur. It's not as effective when there isn't much about the student related to the case.
Okay. Thank you for that, Dr. Desai. Did you want to do about 2 more questions?
Right. Let's do a couple questions. We'll turn it over to Ryan for the last segment. Then we'll come back and do a few more questions.
Okay, great. So our next question is, how can we know what programs are trying to accomplish, as it's hard to find on the website?
Yes, that's a great question. So you have to use every means at your disposal to determine what they're trying to accomplish. So as a first step, going to their website is an excellent way to start. I will tell you that program websites have gotten much better during the pandemic. And a major driver for that is just related to the fact that we can't go visit the program. So the programs are trying to add more and more information in their website, not just in the form of written material, but in the form of videos and what have you. And they're trying to communicate with applicants in different ways, whether it's Twitter or holding meet and greets or inviting people to attend conferences at the program. But when you dive into all the different ways that programs are trying to communicate with you, that's where you really get a feel for what they're trying to accomplish. So I would encourage all of you to utilize all those means of communications that programs have established. And then finally, nothing beats talking to somebody who knows something about the program. So if you can find somebody that has some knowledge about the program, that is often the richest source of information.
Thank you. That next for the next of our webinar. So our next question is, should the personal statement contain only those components that are not seen anywhere else in the e-res?
So they certainly can include things that are not found in other aspects of your application, but there's also nothing wrong with including some things that are found in other aspects of your application, because you have a chance to write about things related to that area that you haven't covered, let's say in the ARAS application, right? So when you do a clinical rotation, for example. You're going to describe it in a certain way, and you're limited in how much space you have. You have that 1,020 characters, including spaces, and so you can convey certain information, right? There's a limit. Now, the personal statement might allow you to go into more depth about something related to that rotation that you did not have a chance to convey in your ARAS description. And that might be something very significant that you're trying to share that reveals a lot about you, right? It could reveal something about your strong sense of responsibility, your commitment to delivering high quality care, your collaboration. Like there's a lot of things that you can get across in that statement by writing about it in a different way or writing about different aspects of the experience that haven't been covered elsewhere. I think
Thank you very
Alyssa,
much.
let's go into our last segment with
Yeah.
Ryan, and then we'll come back and we'll hit some more questions.
Sure. Thank you. Just to pick up on what we were talking about with the personal statement, as we've been working with clients, hearing your stories, so much has been remarkable in terms of the things that you've gone through, the adaptability that we've seen from some folks, the innovation that we've seen, the advocacy. Some people have argued and lobbied and received additional funding or time off, protected time for mental health during the COVID pandemic. And so, inspired by all of these stories, Dr. Desai and I wanted to do something that would help broadcast the stories more widely so that others could be similarly inspired. And at the same time, we realized that this could be an opportunity for some of you who are looking for ways to strengthen your application to get a publication. And the type of publication that we're thinking about is a summary of some event, some noteworthy event in which you overcame adversity, or even that you were permanently redirected because of adversity, in the form of a story that you could tell. And so, inspired by you all, we have set up a contest. We call it the COVID Stories Contest, for you to submit a piece of narrative writing, narrative medical writing. Now, this is a discipline within medicine. Some programs are increasingly embracing training in narrative medical writing. And so this could be an opportunity for you to show these skills that you're already on the path to being able to write. There's a lot of research behind narrative writing, narrative medical writing. It helps people empathize more with their patients. It helps physicians understand the story of a patient and how different people in their lives might contribute to the patient's well-being. And so with the context of narrative writing, we invite all of you to submit a story to the COVID Stories Contest. The rules, the guidelines for the contest are on a website, which Alyssa will share. There are a few benefits to you. You've got a lot going on, but hopefully this small effort will not require too much of your time. The benefits are, of course, you get to share your story if you've done something that you're very proud of, or that you think others could learn from. We would recommend that you submit. You also get to showcase your narrative medicine writing skills on your ERAS if your story is accepted for publication. And it's free. It's not like some of these other organizations or some additional journals that require a fee to submit an article for publication. This is free. We, Dr. Desai and I are hosting the platform to allow you to submit. And so we would strongly encourage you and hope to hear from all of you once you get a chance to look at the website. And finally, one last thought, as we're talking about the personal statement being your handshake, your introduction to the program director or to the reader. letting them know who you are. If you have a story about something that you have done, like we know of people who have set up a field hospital during the pandemic. We know of people who had to stop their day job and go to a facility that is dedicated to handling sequestered COVID patients and all of the things that they've learned from that experience. If you have a way of talking about that very powerful experience in an interview, then that can only help. That's just one more thing that will make you more memorable in your interviewer's eyes. And so this is one additional benefit to having your story published with us.
And I want to add to that the pandemic affected people in many different ways, and obviously, it affected us professionally. It may have affected us personally. We may have had family members and friends who were, affected by COVID. There's a lot of things that happened to us, and is happening to us during this COVID pandemic, and it's shaping us in different ways. And that's also an important story to tell. If you are a different type of physician, if you look at medicine in a different way, or you take care of patients in a different way, or will because of something you have experienced, either your own story with COVID or a family member story, that's the type of narrative medicine piece that's can be very impactful. It can help others see things in different ways. And so to share your story is a real opportunity to to have your voice be heard and to really affect medicine in a very, very meaningful way. And as Ryan said, we're inviting all of you to submit a piece. It's not a long piece, and we know you got a lot of things going on, but I do think it's something that can enhance your application, since narrative medicine is a prominent feature in a lot of U.S. medical schools, and it can be a nice talking point in interviews. And of course, you can add it to your publication section of your ARAS application. And we just think just so much of what you guys have done and experienced. And we've heard so many stories from all over the world that it's real honor for us to be able to highlight those with the general public. And we would do this through publishing this book called COVID Stories. We plan to publish it in September, and we're inviting submissions through August 15th. So if you have something, we would love to hear from you. Okay, so Alyssa, you have some more questions?
Yeah, absolutely. So we're going to dive into some questions for the last part of our webinar here. So I will just jump right in. So our last question that we left off on was, is there a particular low score for
Sorry, Alyssa, I did not hear the last part of that.
Yeah, no problem. I will repeat the question. The question is, there a particular score for internal medicine below which you should mention in your personal statement?
Is there a certain score below which? So we were talking. I believe the questioner is asking about red flags related to low scores, step scores, and at what point in terms of a score should you write about that? That all depends on the specialty. Now, you can find out what those mean scores are among matched applicants through the NRMP document charting outcomes in the match. And you can also take a look at percentage of applicants in your score range that have matched into that specialty. And that give you some sense of the numbers of people and the success rate there. And so if you find that a very small number of people are matching there, that may be a reason to include that in your personal statement. So that's very, very specialty specific. So again, if there's somebody who has that type of question, I would invite you to just reach out to me directly, and I can give you a more informed answer as it relates to your particular situation and specialty.
Okay.
Alyssa,
Yeah, so
I think it's a little choppy, but I'm happy to step in and ask some of the questions, if that's okay with you.
Yeah, yeah, that would be great. I can try to solve the issue while you do that.
Okay, thank you. So one of the questions is incorporating your hobbies and interests outside of medicine important, presumably in the personal statement?
yeah, so that's something that Ryan and I talk a lot about. Sometimes when we send personal statement questionnaires to the students we're helping with personal statements, we'll ask about hobbies, and sometimes that nets really some very unique things, some remarkable stories that could be great hooks. So yeah, sometimes we will feature hobbies. Just depends upon that applicant and their overall profile and how that hobby kind of fits in with everything else. Do you want to comment on that too, Ryan?
Yeah, you don't have to be the Olympic volleyball player from representing your country. If you are just really into chess, and that has formed a backbone of your social activities for a couple of years. You started a chess club at university, and maybe you continued a chess club into medical school. These are the kinds of hobbies and commitments that say something about you, and those absolutely we would want to see. We would want you to think about putting into a personal statement. It doesn't have to be anything dramatic.
Yeah, we've done statements on, you brought up chess. I've done statements on, I remember a woman who was applying for residency uh, from Asia who was a passionate chess player and really uh, did quite well in chess and was recognized. And that was unusual in the sense that in her country, as it is in many countries, chess is dominated by men. So it really made for a very interesting story and a hook as well. We've done statements on people with other types of hobbies and interests. One I remember was quite vivid, was the telling of a story related to whitewater rafting, because this person loved to whitewater raft and done so in many different places. And so there was a very nice hook related to his hobby of whitewater rafting.
Great. The next question is, what should the length be of the personal statement? We talk about
Yes,
this one a lot too.
we talk about this one a lot. So uh, there's a belief that all personal statements should be less than one page. Uh, Certainly, there are some programs that may come across very strongly about that. But in our opinion, in our experience doing this for over 20 years, most programs do not require or insist on one page statements. And the reason I'm talking about that is because when we do statements, we don't like to do statements that are under one page. We typically like to write statements that are a page and a quarter. We found that to be a sweet spot for creating a compelling statement. And so we routinely work with applicants to generate statements of that length. We find that the one page limit is stifling, and it is very hard to create a standout statement in less than one page because you're really talking about 500 to 600 words. That's not a lot of words. And we've routinely done statements that are a little bit longer than one page, but not a lot longer than one page. And we've had a lot of positive feedback from that length. Now, that can be a bit unsettling to hear because the party line from everybody on discussion forums and everywhere else is, hey, you got to be under one page. We don't subscribe to that philosophy, and we have had a lot of success going past a page. If you do have some statements that come off strongly as wanting to be under a page, then we would tell you that, you know, you can have several different statements, one that goes 1 1/4 or 1 1/3, and one that goes less than a page. And you can send those less than a page statements to those that you think feel very, very strongly about it. But ultimately, you know, it's a decision that you have to make. But we know from our 20 plus years doing this that many programs that say we only want a 1-page statement will match people that go past a page if their statement is well done. The bottom line is people will read your statement in its entirety if they are finding the content appealing. If you've hooked them and you build from that hook, you got them all the way to that second page.
Exactly. So we have a couple more questions here, Dr. Desai. One of them is, the only way to show interest in a specific program is to write individual personal statements for every program. Is that what you're suggesting?
That would be a very big job. Okay. And as we said, if you're applying to internal medicine and you decide you're going to apply to over 500 programs, and you're actually talking, hey, I'm going to write 500 personal statements. Now, fortunately, if you do your research on the residency programs, you don't need to apply to 550 programs, right? That number will be far smaller, but still will be a very large number of programs. Now, what I'm saying with those large number of programs, you need to stratify those programs into tiers. So some of you have heard from me as I've talked to you individually about categorizing IMG friendly programs into tiers of friendliness based on your situation. So you all have your unique profile. You all can access the criteria that programs are looking for. And your job with IMG friendly programs is to find those that are in the highest friendly category to your situation. Once you've identified those, that is going to be a much smaller list. And at that point, you can pick and choose where you personalize your statement and write that program specific personal statement. And when you're writing a program specific personal statement, it's not that the whole statement has to be completely different. Quite often, it can be a paragraph that you integrate into the statement that is designed to appeal to that program because you're aligning your background and interests with the mission of that program.
Great. Okay, one more question. I think we have time for one of them. The question is, what sites are you recommending we search for programs that can help us narrow down the programs and fit for each applicant's qualifications?
So, you know, I do recommend that people use Frida. I recommend that people use Residency Explorer. We have our list that, you know, Alyssa and I work on to keep updated of IMG friendly programs by state. These resources don't have a lot of information about fit, but they're, again, going back to what I said earlier about using all the information available at your disposal is key to determine fit, right? Going to the program website, subscribing to their newsletters, attending their conferences, participating in their meet and greets. All of these things give you information. It is a big job. It's not an easy job, which is why I was saying that if you have friends who are going through this with you, you can kind of divide and conquer. And, you know, some of you can assign your friend to X number of programs, you to another Y number of programs, and you can get a lot of this done in a more efficient way in that manner. So that's what some of students have done in the past, and that's what I would encourage you to think about. Okay, so I think uh, there may be some additional questions, but remember, all of you are not alone in this process. You can always reach out to us. We will be happy to answer your questions. You all have my contact number. Remember, our program is not a rotation program. Doing a rotation is just part of our program. What we're all about is helping you get to where you want to be. And we truly consider you to be a part of our MD2B Connect family. And as family, we feel very strongly about taking care of one another. So if you have questions that are unique to your situation, I'm very happy to address them with you. You can always reach out, not just during your rotation, but even after your rotation. We'd love to hear from you, and we're here to help you with your questions. We have a lot of experience in this area, so don't ever feel like you're alone. That's what we're all about, and I really enjoy hearing from you. So, Ryan, any other words before we wrap up?
No, it was a pleasure talking about these topics, which I know are very timely, and I'm looking forward to the next one.
Absolutely. So we do this monthly. So we're going to do it again next month, and we pick topics that are topical, that are important to cover at that point in time. So if you stay with us, we'll be talking about very important things. Obviously, in August, we'll have a session. And as we get into September and October, we're going to be talking about interviews. So there's going to be a lot of good stuff about interviews. So please stick with us, join us. And if there are any things that you want us to cover in the future, you can always send us an email. Okay, so it's been a pleasure to have you on board with us in today's webinar. And thank you for joining. And I look forward to talking with all of you very soon.